asked to share tonight a little bit about August 7th and the safety levy, mental health levy that's on the ballot in Stark County. And so what I want to do is, and what I was asked to do is just give a little perspective of what we're facing in our community and in Stark County as a whole. So that's what I'd like to do. I'm going to just throw a few numbers at you, but more importantly is just the impact that this has. And I believe what we're going to talk about tonight is probably the most important issue that we're facing right now as a community, not just in education, but I believe our community at large. This past year, everything changed. Since August of 2017, there have been 15 suicides in Stark County, and of school-aged children. And there have been 25 total student deaths in Stark County. And unfortunately, in Plain Local, we had a car wreck with two brothers that passed away at the wreck. So that really changed everything as far as what we're dealing with, what our kids and our families and our community are dealing with. To give you a little perspective, since 1980, Stark County was averaging 1 to 2 suicides a year. And so the question then that everybody has is why 15? Why so many? Why the spike in everything in all of the school districts? Last year as a whole in Stark County, and these numbers, when you type them, it's one thing, but when you start to read them, it's like, okay. Last year in Stark County, 199 kids, okay, ages 15 to 17, went to Altman Hospital for mental health issues, including suicide ideation and suicide attempts. Okay, 199. 72 of those were kids from Plain Local. So that's the Altman. To Akron Children's Hospital. And when I say Akron Children's, that could be the inpatient, it could be partial hospitalization, or it could be an intensive outpatient treatment for mental health issues. 1,344 kids in Stark County. And 493 of those kids were from Plain Local. So when we talk about the impact that has and what our families are going through, what our kids are facing, it's pretty extreme. When all of this took place, the Center for Disease Control got involved, CDC, and they were asked by the Stark County Health Department and the Ohio Health Department to come to Stark County and say, hey, let's try to find out what's going on. We gave a survey, and school districts could opt out if they wanted to. But most school districts gave a survey to students in grades 7 through 12, because below that, some of the content was pretty sensitive. So kids in grades 7 through 12. And what we learned was that 9% of the students surveyed at Plain have attempted suicide at one time. 9%. We have about 6,100 kids. Okay? And those are all kids that may come from Jackson, Lake, or Hoover into our career tech programs. So 6,100, not all at the same time, but at some point. 10.5% of kids that were surveyed at Plain, again, 7 through 12, endorsed suicide ideation with a plan during last school year. And the highest percentage was females in 12th grade. And that
Seniors. Yeah.
That kind of shocked me when you start, thinking about that and think about kids, So you wonder then about their thought process. You wonder about their hope. So I believe we have to give kids hope. If nothing else, we got to give them hope. So when you look at that, and you also look at this past school year, there were a lot of threats in schools. And as you know, there were several school shootings around our nation. Ohio is number 2 in the nation this past school year of school threats. We were number 2. And I will tell you, and Mr. Halkias will tell you because we talked a lot, we were dealing with that almost daily. And it was the copycats. It was social media. Facebook, Twitter, Snapchat. And these things are, people post something and it's shared 50, 100, 150 times, and sooner or later, then by the time the real story got to me, it had been inflated so much you really didn't know what was true. You were trying then to back it up and work through it. We work day and night, I will tell you this. We would get a threat, and we would immediately talk to the Stark County Sheriff's Office, because that's the sheriffs. They work with our schools, and they would be out at homes 2, 3, 4 in the morning. Because what we wanted to make sure is that the next day, as soon as school started, that the schools were safe. So talking to parents, talking to kids, whatever we needed to do, all hours of the day and night. And I will tell you that Stark County Sheriff's Office has been nothing short of amazing. Sheriff Meyer, Deputy Smith, he's our school resource officer. They were amazing. But it's social media, it's the copycats, and a lot of this is through our media, everything is glorified. So for our kids, whether it's on the side of suicide or on the side of a school threat, they see what these kids, they're being publicized, they're being talked about, their faces are over the paper or the news channel, and then they say, I want to be him or her. And it's creating lots and lots of problems in our community. So the CDC, with that information, we're taking that now and we're trying to dig through it. And then we're going to start our school year off by talking to our staff and our parents about this is what the kids said. 85% of our kids completed the survey. That's a lot. That's a really high percentage. I was happy with that. And in order to be part of that 85%, you had to complete the whole survey. You couldn't skip around. So that was a good percentage of our kids that took it seriously to answer the questions.
Now, does everyone know what the CDC is? We tend to kind of throw acronyms around. The CDC is the Centers for Disease Control. It's a national organization that came to Stark County because they recognize we have a huge problem here in the county.
So our belief is, and part of the push for the August 7th levy, okay? There's two factors on August 7th, safety and security and mental health. All right. So because of everything that was taking place, there was a county task force that was created. So it's important to know who was on that task force. It wasn't just educators. We had FBI, we had Sheriff Meyer, Homeland Security, and many law enforcement departments, Canal Fulton, North Canton PD. Those people were part of this because we needed some help. Like, what should we be looking at? What should we be talking to our community about doing? They made some recommendations. They said, one, the first recommendation they made was having additional law enforcement at the buildings. That was the first one. Second one was mental health. I believe they go hand in hand. I don't think there's a whole lot of separation. I think they go together. The third was metal detection wands. So it's kind of like when you guys know what those are. When somebody wands you at an event or something to see if you have something on you that you shouldn't. They talked about a system that would give access, video access, to first responders, fire, police, EMS. So if there's an issue at Glen Oak High School, they pull up to it and they can see on their screens in their car or whatever what's going on. And we have that. And it does work very well. A way to allow access for people to come into a building. So if John would come into a building, that he would have to give his ID. They would swipe the ID, and then we immediately know if John had, let's say, an outstanding warrant. Let's say they were a sex offender. So to know who's in your building immediately. And all of our buildings, to get into them, you have to be buzzed in to get in. Okay. They also talked about a curriculum called Sandy Hook Promise. I think we all know what Sandy Hook. There's a tragedy in Connecticut when the shooter got in and killed multiple children at an elementary. The gentleman who runs Sandy Hook Promise, his daughter was next door to the room where the shooting took place. And he has started this nonprofit. It's a curriculum and it's a reporting system, and it's all free, that connects first responders, law enforcement, to the school immediately upon, let's say there's a threat. It's also a curriculum schools can follow for bullying, those types of things. Training for bus drivers and bus aides. Our bus drivers are the first ones who see our kids in the morning. They know immediately what's going on. You can tell when they walk on the bus. So how do we train them what to look for, what to do? If there's an issue, what do you do? Because they are truly, if you talk about a first responder, our drivers are. And they also talked about training for kids for this, they call it digital citizenship, which is basically how do you use a computer the correct way? What are the ethics? How do you use social media? What do you do? And right now, our kids struggle with that. Our adults struggle. Right?
Why don't I take the next part, which I know people always have questions about, the two things that they did not recommend that we do. The first one is metal detectors. And I get more questions about, well, why don't the schools just put in metal detectors? You go to an Indians game, you go to the Cavs game, they've got the metal detectors now, or Browns game, whatever event you go to, they have those now. But logistically, when you look at a school building, which is a public building, versus somewhere that you pay to get in, where the crowd's all coming in pretty much at once, it's a logistical nightmare, plus all the doors that we have. There isn't just one entrance to the school. The other issue is arming school employees. And I'll tell you what the position of the Ohio School Boards Association is, and it happens to be my position as well. That's a local decision. The voters and the community where people reside should make that decision for themselves. This isn't a one-size-fits-all answer to what's going on. I've talked to superintendents in school districts that are in very rural areas where everybody has a gun and everybody carries a gun, and maybe that's okay for their community, but maybe it's not okay for the plain local community. When Brent met with those people, they do not suggest arming school employees. And quite frankly, I'm not in favor of it in our community, but I'm one school board member. I'm not all five. But I don't think that would happen in Plain, and I don't know what would happen in other districts as far as arming staff. There are some districts in Stark County who are doing it.
And they really talked about arming, if you decide, if a school board would decide to arm teachers, that they would have to go through training set forth by the Stark County Sheriff's Office, some very specific training. And, at the end of the day, when John and I have talked about this, and, you all think about your own kids or relatives you have, how do you, in a time of crisis and that training that's needed, how do you make that decision? And how do you know, if there's a lot of kids or a lot of adults, how do you know? And I believe that's a heck of a responsibility to put on the teacher.
And that's why our feeling in Plain is that we bring in professionals. We hire more deputies to be part of our security in our buildings so that there are people who have the training and the background. Heaven forbid a school employee has a weapon and an innocent child gets hurt or killed because they don't have the training or the background. That's our biggest concern.
So, what are we doing, right? I'm going to first start with the Plain Local, and then I'll move over to the county. As far as Plain Local, next year we're going to be adding 5 additional Stark County Sheriff deputies to our schools. We'll have 2 at the high school, 2 at our middle school, 2 at our intermediate school, and then we're going to have 1 east side, 1 west side for our elementaries. Okay, that's the first thing. The second thing that we've done is we've secured a 10-year agreement with Child and Adolescent Behavioral Health to be on-site, to have a full-service office on-site at Glen High School. We believe that's key in all of this. How do we get access and services to our families at a place where they know they can come, they know where it's at, they know where to go. It'd be a separate entrance, and they can go in there either as a family or they can go during the school day, whatever they need. And that office will also service other communities as well. is just going to be located on the campus of the high school. Like I said at the beginning, I believe that's a two-part approach to it with the sheriff deputies and CNA. We have the system I talked about, first responders coming to a building, they can see, they know what's going on. There are now radios in every one of our buildings. They're called Marks radios. And basically what that is if there would be an incident, you click a button and then any first responder, law enforcement that's in the area will get that response and then go to the building that's impacted. No matter where they're at, no matter who they work for, you click a button, boom, they're all there. And that's very, very important. At all of our buildings, we have strobe lights. They're blue strobe lights. And so for our buses, it's a visual for them. If they pull in with kids and they see the blue strobes going off, they pull right out. And what happens when those lights go off, there's an announcement. There's a PA system right next to it that will say, do not come in. So if anybody be walking to the library, if they'd be walking to CNA, they hear that, they get away. Same thing, we have them inside in our gyms. We're going to be putting them in our hallways. And it's that visual for our kids and our adults. Okay, you see those, something's going on, get to shelter or don't come in. We've already secured Sandy Hook Promise. That's that curriculum, that reporting system I talked about. Most people don't notice we do 19 drills a year mandated by the state of Ohio for our kids. And when we went to school, tornado drills were a big thing, right? I mean, it was, I remember. But now for our kids, and it's funny because I talk to my own children, they will come home, they'll say, Dad, we had a lockdown drill. Dad, we had an evacuation drill. Yes. That's a whole different conversation at home than a tornado drill.
For those of us who are older, we remember fallout drills.
Get under your desk.
Get under the desk, but to me, it's alarming and sad because you've got little kids now who have to go through a drill, what to do when there's an active shooter. How sad is that, and how traumatizing is it for young children? And that's why I'm so proud of what we're doing by bringing in child and adolescent services right on campus, because this isn't just about the person who comes in with the gun. It's about preventing that from ever happening by providing mental health services for kids who need it.
And the school, the additional Stark County Sheriff deputies, if anyone knows Officer Chad Smith, Deputy Chad Smith, he's about 6'6", 260. That helps, right? But our kids love him. And they go up to him, even the smallest of kids will go up and talk to him. That's the idea. Let's get our kids talking. If I'm in a uniform, that's okay, go talk to him or her. And that's where we will make the most gains with our kids, because our kids always know what's going on. They know. We just got to find the right people and the right time to get to them. We don't care how they tell us, just tell us. And that's the whole thing with Sandy Hook. See something, say something. Even if it's small, tell us. And so we feel with getting more deputies, it's not about hardening the schools or having somebody stand there with a gun, but it is about, they're visible, yes, but it's also for that little kindergarten to go up to a deputy and say, talk with him or her, maybe about them, maybe about their family, whatever. Make that relationship. We meet every year with our first responders, and this fall we're going to be doing an active shooter training for our staff. That's going to be one of our in-service days where our first responders will be there, sheriff's office will be there, and we're going to take our entire staff. What would you do? What would the situation feel like if we actually had a shooter? What would you do? And why I feel really sad to have to do that, I know it's one of those things that I have to do because they are in charge of those kids. Because we can say all we want about, I have this training or that training, but if that would happen, they're going to look at that teacher and say, what do you want me to do? Our staff and our kids know how to barricade a door. We got to get better at that, but they know how to barricade their door. They know how to use a belt to put around the door handle. to make sure that they could hold it if somebody's trying to get in. We have codes with our first responders. You don't knock on a door and just come in. There's codes. So we have all that.
The other thing that Brent and I have talked about, while we're doing all this training in the school, we have to start thinking about training our community too. I talked to the gentleman who was the superintendent at Chardon, who now talks about this stuff because they had an active shooter in their school. And I get texts and phone calls immediately whenever anything happens at the school, because kids are all connected now. And we have to train our community too as to, if a situation like this happens, where do you go? How will we communicate to you that your child is safe? So that's another piece that we have to put together with this too as well, to train our parents as to what's the right thing to do if something were to happen.
The reunification of families is the hardest thing in a crisis. And we've heard that over and over and over again. And unfortunately, we saw that locally as well this past school year. How do I get my kid? And then what do you do if you're told you can't get your kid? It's going to take a while. What do we do? And can I pick my kid up if I don't have my license? Can I take my neighbor kid? All those things we got to work through. The county, and I have to, really commend the county, Judge Haddock and the office over there, because they were able to work with our local legislators in order to get this levy on the ballot on August 7th. We can talk about state testing all we want, but until we get this right, the state testing is not going to matter. Because if we don't get kids healthy, they can't learn. They can't. So Joe and his team were able to get this for August 7th. They put together the county task force. They brought in Sandy Hook. They brought, when we sit around and we meet on this stuff, you have all the law enforcement, and then over here you have all the mental health organizations locally that are there. For the first time, everybody's in the same room. And in order for this problem, for us to start and continue to work through it, everybody's got to be in the same room. There can't be silos. There just can't be. Because it doesn't matter if you live in Plano. If you walk through Glen Oak High School on a normal day, you'll probably see a Hoover jacket, a Jackson jacket, maybe a Lake jacket. But those are all kids that come over to our school to take classes that are from all those other school districts. And that's okay. But those kids, and the importance of this levy is, it doesn't matter if it's a Plain kid or any other kid. What are we going to do to protect them and keep them safe and get them and their families hopefully access to services that maybe they need? So I believe that this issue on August 7th doesn't have boundaries. But that's my opinion. Okay.
Well, and it's also important, and why are we on the ballot and why is there an issue? If you don't know about school funding in Ohio, I'll be happy to talk to you anytime about it and how inadequate it is and disproportionate it is. But schools are now being asked to do all of these things. And where is that money going to come from unless we find some other way? It's going to come out of the classroom. I mean, we're committed to keeping our kids safe no matter what, but this levy will provide us with the means to help them more in the ways that we're being called on now to help.
They have told us, the experts, and then we're going to be done and we'll be glad to take questions. The experts have told us from the CDC, Center for Disease Control and others, this problem is not going to go away. What worries me the most is August and September, because even though school may be only 9 months, these issues, they're taking place all the time. So how do we close the information gap? Sometimes, right, June, July, and August. Because what's going to come back to school and what the issues are that are going to come back to school in August and September, we're going to have to deal with those. And so we have to have the resources in order to do that. And quite honestly, for our teachers, I start teaching 4th grade. When you say to a teacher, about classroom management, discipline in classroom, well, they're saying, well, what do you want me to do? 1 in 3 kids, or either 1 in 3 or 1 in 4 kids in Stark County now are hungry. You're talking about a mental health concern that a child or a family may have. It's about 1 out of 3. That classroom looks so different than it did 5 years ago, 10 years ago. And our teachers need to be equipped with the training and the resources to help those kids. So if it's not us, then who's going to take care of these kids? Because if we don't, then our future is going to look a little different than what it should. So that's what's coming on August 7th. We believe, and I believe it's the most important thing we're dealing with right now in education. And I believe as a community and someone who lives here, we're at a crossroads. I really honestly believe that with our kids and our families. And we have to do something. 15 suicides. When I say that, it's heartbreaking. So we have to do something. So with that, we'll take questions.